How to combat peripheral neuropathy. Natural remedies you need to know. The idea of treating a disease from the comfort of your own home may seem a little strange, especially if it's for a complicated disease, such as peripheral neuropathy. However, besides medications and treatments, there's always something you can do to ease your pain. Over 20 million people in America experience some kind of peripheral neuropathy, so combating the disease yourself seems like an idea that we should consider. Before we dive any deeper into this subject, let's start to understand what peripheral neuropathy is. Neuropathy means a disease of the nerves that can eventually lead to sensations such as pain and numbness, and can also affect muscle control. Peripheral neuropathy means problems with the peripheral nervous system. Our nervous system can be divided into two parts, which are the central nervous system, or CNS, and the peripheral nervous system, or PNS. The CNS includes the brain and the spinal cord, and the PNS contains all nerves that branch off from the spinal cord. Any kind of problems associated with the nerves that are part of the PNS can be causing peripheral neuropathy. The pain and discomfort associated with peripheral neuropathy depend upon the types and the number of nerves that are affected. However, the problems of people with peripheral neuropathy can be very life-altering, so it is important to detect any possible signs. In this video, we would be telling you how to fight peripheral neuropathy using natural remedies that you can easily manage on your own. But before we do that, let's understand how to detect some signs and symptoms of the disease. These symptoms can be very wide-ranging, from loss of control to mild indications of nerve damage, but we'll share some common ones with you. Number 5. Stomach issues. Damage to autonomic nerves may cause digestive problems in people with peripheral neuropathy, and the stomach may not be able to function properly. This can lead to nausea, losing appetite, and eventually weight loss. Number 4. Inability to feel touch. Sensory nerves carry signals from the receptor cells upon contact and transmit information to the central nervous system. However, when these nerves are damaged, people are unable to feel touch. You might be holding a fluffy plush toy, but be completely unable to feel its softness. Number 3. Inability to feel pain. Neuropathy can be very painful, but in some cases, the person may not feel pain. In small fiber polyneuropathy, the body is unable to feel pain. This is because these small fibers in the nervous system contain axons that are responsible for transmitting the sensation of pain. When they are damaged, the person may be touching a hot bulb but not feel anything. Number 2. Muscle twitching. When motor nerves are damaged, they can cause problems in muscles. This means that a person with peripheral neuropathy may experience muscle twitching and also a lack of coordination in his movement, since motor nerves help with movement. Number 1. Cramps. Pain is one of the most experienced symptoms of peripheral neuropathy, especially if the disease is in a more advanced stage. Muscles get affected when motor nerves are damaged, and this can cause painful cramps. Now that you have some idea how to detect peripheral neuropathy, you might be wondering what causes such pain. Well, there could be many reasons. Number 5. Diabetes. You might find it hard to believe, but around 1/3 to half of the people with diabetes have peripheral neuropathy. This is because the increased level of sugar in the blood can ultimately damage the nerves, causing them to not function properly. Number 4. Physical damage to nerves. A bad car accident, injury from a football game, or other types of physical traumas can cause damage to the nerves and lead to peripheral neuropathy. Number 3. Guillain-Barré syndrome. In Guillain-Barré syndrome, or GBS, the body's immune cells start attacking peripheral nerves, and the person may develop peripheral neuropathy. It is mostly common in adult males, but people of all age groups may be affected. Number 2. Autoimmune diseases. Just like GBS, other kinds of autoimmune diseases may also attack peripheral nerves and cause such damage that they have difficulty functioning properly. Lupus, Sjogren's syndrome, and rheumatoid arthritis are some examples of such diseases. Number 1. Kidney disorders, or CKD, can lead to many problems in the body, one of which is peripheral neuropathy. For CKD, the neuropathy is known as uremic neuropathy and is so common that in one study, it was reported to have affected 90% of dialysis patients. This all must sound a bit daunting. After all, the nerves are connected to millions of cells that coordinate so many things in the body. Fortunately, there are many options available to help ease the pain that patients with peripheral neuropathy go through. These include pain relievers, such as NSAIDs, and also some anti-seizure medicines that also help with the pain. Besides medicines, some other treatment options include surgical procedures, but that only happens in severe cases. Some doctors also advise getting physical therapy to help relieve pain. In some cases, the doctor might suggest placing a neurostimulator in your body. These devices help stimulate the spinal cord and work to block the passage of pain signals to the brain. But what can you do when you're at home, tired of all the medicines? Well, there are some things you can do to help relieve yourself from the pain, and luckily for you, we've compiled a list of some natural remedies for peripheral neuropathy. Number 8. Take your vitamins. Sounds like a piece of very generic advice, but trust us when we ask you to revisit your diet plan and check for important vitamins. For neuropathy patients, the intake of some essential vitamins is very crucial to their health, and many of them help in managing pain, but some are important for maintaining good health for the nervous system to function properly. We're particularly talking about B vitamins, such as B1, B6, and B12. When the body doesn't have enough B12, the myelin sheath that protects the nerves can become damaged, and the nerve cells lose their protection, leading to neuropathy. Eating fish such as salmon and tuna can be helpful. Other great food options include poultry, green peas, eggs, and dairy products for people with peripheral neuropathy. Number 7. Do some meditation. Exercises that can help calm you down and put you in a state where your mind feels at ease and peace can be super beneficial. When you focus on deep breathing exercises and become conscious of your breathing, your mind gets distracted from the pain and causes the muscles to relax, and this can help manage pain caused by neuropathy. Number 6. Drink less alcohol. Alcohol has been associated with neuropathy, and alcoholics that suffer from neuropathy complain about pain in their body extremities. Therefore, limiting the use of alcohol can help ease the symptoms of peripheral neuropathy to some extent. Number 5. Try acupuncture treatment. The idea of getting pinched by several tiny needles to be relieved of pain seems unrealistic, but hey, it works. Acupuncture techniques involve pushing tiny needles at various points of pressure on the body to help restore balance. It is said to be good for pain alleviation because it is believed to help with blood flow, which can help the damaged nerves. There might be mixed opinions regarding acupuncture for neuropathy, but you can't know unless you try, right? However, it should be only done by an expert. Number 4. Quit smoking cigarettes. Many studies have linked smoking to worsening neuropathy symptoms, because the longer a person smokes, the worse their pain gets. Besides causing intense pain, smoking cigarettes contain various other dangerous substances that can harm the body. It only makes sense to quit smoking cigarettes so that the body can recover from the damage. Number 3. Watch what you eat. Remember when we told you that vitamins are good for people with peripheral neuropathy? Well, they aren't the only nutrients that you can use. For example, magnesium and calcium have been found to help with neuropathy. So eating nuts and drinking milk is a good idea. A study found that taking supplements of alpha-lipoic acid or ALA helped to reduce symptoms of neuropathy. So remember to eat your broccoli. Number 2. Add some peppers to your diet. We think that cayenne or chili peppers deserve a special mention here because they contain capsaicin, which helps with reducing pain caused by neuropathy. It is usually available as a topical application, and high doses of capsaicin are administered by a medical professional. Whether to use or not to use this topical treatment option is a decision that your doctor can help you make. Number 1. Take a nice warm bath. You might think that taking a long warm bath is too romanticized in movies, but don't underestimate the soothing effect it can have on your body, especially in helping the blood flow and calming yourself from the pain. So there you go. We've shared our list of remedies for combating peripheral neuropathy with you, but how can you know which one works for you? Well, you can always try them one by one to see which one suits you the best. But before you make some major changes to your lifestyle or dietary intake, remember to get a doctor's opinion, because they know what's best for you. If you liked the content of this video, make sure to leave a like. We would also like to know if you have combated peripheral neuropathy in some other way that we didn't mention. So remember to leave a comment below. Share this video with a friend and subscribe to our channel so we can keep bringing you helpful information about your health. Catch you later!